Namaste Bitia, Hamisha खुश रहो बिटिया. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Hemopartic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this series, we are going to discuss about hematology and the various hematological disorders that we are going to encounter in our day-to-day practice. So let's start with this particular chapter. Today, we are going to discuss about anemia. Now, first of all, let us try to understand the basics about the hematology. What is hematology? Because you are getting a lot of questions on various diseases that are related to the hematological system. So what is hematology? Hematology, it is basically the study of the blood in the health and disease. So whenever we are studying about the blood in both the healthy condition as well as in the disease condition. Now, hematology deals with the problems of the red blood cells, the white blood cells, the platelets, the blood vessels, the bone marrow, the lymph nodes, the spleen, and the proteins involved in the bleeding and clotting. So what is hematology that is dealing with? Hematology is basically the study of the blood in the healthy and the disease condition. It includes the problems that are related to the red blood cells, the white blood cells, the platelets, the blood vessels, the bone marrows, the lymph nodes, the spleen, and the protein involved in the bleeding and the clotting, that is known as hemostasis and thrombosis. Now, what are the various common hematological diseases that we are going to discuss in this particular chapter? There are various hematological disorders that we are going to study. The diseases will include anemia, different type of hemoglobinopathies. We are also going to discuss about leukemia, lymphoma, and coagulation disorder. So the various disorders that we are going to discuss here includes anemias, hemoglobinopathies, leukemia, lymphoma, and coagulation disorders. Anemia, hemoglobinopathies, leukemia, lymphoma, and coagulation disorders. Now, before we start, we must recall how the blood cells are forming. So I have given you a flow chart, and it is also present in your book, of the different cell lineage, like how the cells are forming, what is the first precursor cells, and then what are the cells that are leading to the formation of myeloid cell series, erythrocyte or erythroid cell series, and the megakaryocyte or the platelet series. So all these cells are forming from the hemopoietic system or the progenitor cells. From these things, we are getting two common myeloid progenitor cells and the common lymphoid progenitor cells. From the common lymphoid progenitor cells, we are getting lymphoblast, we are getting polymorphocytes, and leading to the development of lymphocytes and natural killer cells. So lymphocytes, we are of two types, B lymphocyte and T lymphocytes. And the third thing is the natural killer cells. Now, from the common myeloid progenitor cells, we are getting two lineages. One is megakaryocyte, erythrocyte progenitor cells, and the second one is the granulocyte, monocyte progenitor cells. From the granulocyte, monocyte progenitor cells, we are getting myeloblast. Myeloblast again is having four type of cells. Number one, we have basophilic promyelocyte, from which we are getting basophilic myelocytes or metamyelocytes. Then we have basophilic band cells, then basophils. From the second line, we have neutrophilic promyelocyte, then we have neutrophilic myelocyte, next neutrophilic band cells and neutrophils. Third, the eosinophilic promyelocytes, we have eosinophilic myelocytes, eosinophilic band cells, and eosinophils. The fourth lineage is the promonocytes, from which we are getting monocytes and macrophages and the dendritic cells. The third lineage is the megakaryocyte, erythrocyte progenitor cells, from which we are getting RBCs and the platelets. So first of all, we are getting proerythrocytes, erythroblast, then erythroblast, then we will be getting polychromatic erythrocytes, and then the erythrocytes that are known as the RBCs. In the next line lineage, we will be getting megakaryocytes and promegakaryocytes, then megakaryocytes, and last is thrombocytes or the platelets. So in this way, we are getting the platelets, we are getting the RBCs, we are getting the basophils, neutrophils, eosinophils, macrophages, dendritic cells, lymphocytes, and the natural killer cells. So this is all consist of the cell lineage, means how the different type of cells are formed. Now, what are the various sites at which these cells are formed? So what are the various hemopoietic sites? The various hemopoietic sites includes the bone marrow. In the normal child and adult life, it is marrow. It is the only source of new blood cells. What are the other sites of hemopoiesis? In the fetus, from 0 to 2 months of age, it is the yolk sac. From 2 to 7 months of age, it is the liver and the spleen. From 5 to 9 months, it is the bone marrow. In the infants, bone marrow, practically all bones are producing these cells. In the adults, we have vertebra, ribs, sternum, skull, sacrum, and pelvis with the proximal ends of the femur that are producing these cells, blood cells. Now, coming back to hematology. Hematology is basically a branch of medicine that is involving the study and treatment of the blood. So we are getting the study and the treatment of the blood. Anemia. What is anemia? Because today we are going to discuss about anemia, its classification, and the various blood indices. So anemia is defined as the reduction of hemoglobin levels below the normal values for different age and sex groups. So anemia, it is basically defined as the reduction of hemoglobin levels below the normal levels for different age groups. So in hematology, we will be dealing with the study and the treatment of the blood. The anemia, what is anemia? It is defined as the reduction of the hemoglobin level below the normal values for different age and sex groups. So if the hemoglobin level is going below the normal values for different age and sex groups, it is known as anemia. What is anemia? It is a decrease in the total amount of blood, red blood cells or hemoglobin in the blood. So anemia will be said if the RBC level is going down or the hemoglobin level is going down in the blood, or a lowered ability of the blood to carry oxygen, or if the blood is not able to carry oxygen properly, then it will be called as anemia. Anemia, it is defined as the reduction of hemoglobin levels below the normal value for age and sex. Now, what is the classification of anemia? How to classify anemia? How you will be able to classify anemia? So anemia will be classified by different ways on the basis of cause. If there is decreased production of red cells, if there is increased destruction of red cells, or if there is any acute blood loss. So on the basis of the cause, anemia can be described as because of the decreased production of RBCs, increased destruction of the RBCs, or if the RBCs are lost due to the acute blood loss. Now, on the basis of the cause, as I have discussed you, there is blood loss, inadequate production, and excessive destruction. The second variety is morphology. Morphological classification of anemia, that is based on the size or shape of the RBCs. It can be microcytic, hypochromic. It can be normocytic, normochromic, or it can be macrocytic, normochromic. So based on the morphology, we will have microcytic, hypochromic anemia. We can have normocytic, normochromic anemia, and we can have macrocytic, normochromic anemia. Microcytic anemia is seen in case of iron deficiency anemia, in case of chronic infections, in thalassemia, in hemoglobinopathies, and sideroblastic anemia. Normocytic anemia will be seen in case of chronic diseases like CKD, early iron deficiency anemia, hemoglobinopathies, primary marrow disease, combined deficiencies, and increased destruction. So normocytic anemia will be seen in case of chronic disease like CKD, early iron deficiency anemia, hemoglobinopathies, primary marrow disease, combined deficiencies, or increased destruction. Macrocytic anemia will be seen in case of megaloblastic anemias, liver diseases, alcohol, hemoglobinopathies, metabolic disorders, marrow diseases, and increased destruction. So macrocytic anemia will be seen in case of megaloblastic anemia, liver disease or alcohol, hemoglobinopathies, metabolic disorders, marrow disorders, or increased destruction. Now we come to the functional classification. So we have discussed about the classification on the basis of the cause, that is reduced, decreased production of RBC, excessive destruction of RBC, and acute blood loss. Next, we come to the classification of anemia, that is on the morphological basis, in which we have studied microcytic hypochromic, normocytic normochromic, and macrocytic normochromic. Next is the functional classification. Functional classification is done due to the following things. When the function of RBC is destruction, or when the functioning of the body is destroyed. For example, in case of marrow production defect, when there is defect in the production of the bone marrow, there is hypoproliferation of the bone marrow that will be seen in case of marrow damage or iron deficiency anemia. So marrow damage or iron deficiency anemia, there will be red cell maturation defect. Red cell maturation defect will be seen in case of ineffective erythropoiesis. Ineffective erythropoiesis that would be seen in case of cytoplasmic defects, iron deficiency, thalassemia, and sideroblastic anemia. So marrow production defect we are going to see in case of marrow damage and iron deficiency anemia. Red cell maturation defect we are going to see in case of ineffective erythropoiesis, that includes cytoplasmic defects that is seen in case of iron deficiency anemia, thalassemia, and sideroblastic anemia. There can be different type of nuclear defects, which includes folate deficiency and vitamin B12 deficiency. So we can have folate deficiency, vitamin B12 deficiency. There can be a decreased red cell survival. Decreased red cell survival is seen in case of blood loss or hemolysis. In case of blood loss, hemoglobinopathies, and membranous abnormality, etc. Now, there are three different types of indices that we come across from the blood investigations. We can see MCV, we can see MCH, and MCHC. MCV is mean corpuscular volume, MCH is mean corpuscular hemoglobin, and MCHC is mean corpuscular hemoglobin concentration. So what happens in MCV, mean corpuscular volume? It is PCV, packed cell volume in liter per liter, divided by RBC count. So its normal value is around 85 plus minus 8 femtoliter, or the range is 77 to 93 femtoliters. And the second is the mean corpuscular hemoglobin, that is hemoglobin per liter divided by the RBC count per liter. So if these values are increasing, that means either the PCV is reducing, packed cell volume, or the RBC count is increasing. The mean value for MCH is around 29.5 plus minus 2.5 picogram. Now, the third variety is the mean corpuscular hemoglobin concentration, that is MCHC. It is defined as the hemoglobin per deciliter divided by the packed cell volume in liter by liter. The normal value is around 32.5 plus minus 2.5 gram per liter. Now, what are the clinical features of anemia? There will be non-specific symptoms and the specific signs and symptoms for anemia. Whenever a patient of anemia is coming to us, the patient can present to us with non-specific signs and symptoms or the specific signs. So non-specific symptoms includes tiredness, fatigueness, breathlessness, lightheadedness, ankle swelling, development or worsening of the ischemic symptoms like angina or claudication. So non-specific symptoms, the symptoms which we are going to see in the patient, or the patient will tell us the symptoms, the patient tells us and the signs we can observe in the patient. So non-specific symptoms of anemia that the patient is going to tell us is the lightheadedness, the tiredness. The patient will say that he or she is getting tired too much these days. There will be lightheadedness, there will be breathlessness, difficulty in breathing on doing slightest exertion. There will also be ankle swelling that we are going to observe, and there is development or worsening of the ischemic symptoms like angina or claudication. So these are the non-specific symptoms that the patient will tell us. Next, we will come to the non-specific signs, the signs that we are going to observe in the patient. Non-specific signs includes mucous membrane pallor, we can check for the pallor. Tachypnea, tachypnea means increased breath rate, raised jugular pressure. So jugular venous pressure will be raised. We will also going to observe different type of flow murmurs. There will be ankle edema. Ankle edema is both a symptom and a sign. There will be postural hypotension. As soon as the patient sits up, there is decrease in the blood pressure and tachycardia. So we have tachypnea, we have tachycardia, we have postural hypotension. There is ankle edema, flow murmurs, and mucous membrane pallor with raised jugular pressure. So this was all about anemia. Now I would ask you to go through the book and write down the classification of anemia, because many times classification of anemia is asked in the examination for 20 marks. So you have to define anemia, you have to classify anemia, you have to write the different types of anemia, and also you have to draw the cell lineage that I have just discussed with you. Now we are going to discuss more about anemia and its classification in the next lecture. I hope you have understood this session properly. If you have any query, please mention in the comment box and I'll try to resolve it. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting with a new topic of anemia in the next lecture. Thank you very much.